So I'd like to welcome you to Bothwell Regional Health Center's second annual sports update. My name is Doug Kibbers. I get to be your MC today. And a few housekeeping details. If you could turn down your smartphone, your smart watch, your smart glasses, probably smart shoes by now. A few details, bathrooms out in the foyer. There'll be a break about halfway through. Should be time for questions from the speakers. If not, they'll be around during the break and probably afterward somewhat as well. And as we all know, confidence has a lot to do with performance, whether in music or sports. This young man was going outside with his ball and glove, announcing to really nobody there, "I am the world's greatest hitter." He threw the ball up and took a swing, and it hit the dirt. Kind of pulled up his pants a little bit, announced, "I am the world's greatest hitter." He threw the ball up, took an even bigger swing, thud, the ball hit the dirt. Spit on his hands, kicked his shoes, pulled up his pants, took the biggest swing ever. When he threw it up, it hit the ground. He threw the bat down. "I am the world's greatest pitcher." Who knew? You know, the National Athletic Trainers Association was formed in 1950. Their first meeting was in Kansas City. So sports medicine has always been a team approach, and they're an increasing important part of the team in athletic trainers. They help take care of the 8 million student athletes in high school, 500,000 student athletes in college, who knows how many pros, and even weekend warriors. So today we'll have Andre Taylor, Smith Cotton, athletic trainer, and also Corey Bowling, who is the Bothwell Peak, both athletic trainer and assistant physical therapist. Tell us a little bit about the profession, training, and portions of athletic training. So welcome, Corey and Andre.
So I'd like to start off by saying thanks to Dr. Kibbers for having us come here to speak today. First off, a little bit about what got me kind of into the athletic training and the medical field. I played soccer, and I had many injuries that required a little bit of physical therapy. So it got me in the clinic and kind of got me used to being around, getting people feeling better, and also getting myself feeling better to where I could get back out on the field and start playing again. So we're going to go ahead and get started. Kind of focusing, athletic trainers focus primarily on prevention of injuries. If you can prevent an injury from happening, you can definitely keep all the athletes there on the field. That's the sole purpose of doing that, is to keep them out on the field and keep them playing and healthy. Certain ways you can do that is by going through the equipment, making sure your equipment's properly put on, shoulder pads, helmets, make sure the helmets are aired up properly, to mouth guards. Just simple things like that can keep people healthy to where, you know, they don't get hurt. Also, if somebody does have an injury, say they have an ankle that's a little bit weak or something, you can go ahead, you can do some tape and different things like that to where they don't further injure themselves. You can keep them healthy. Next thing is kind of immediate and emergency care. So this is whenever an athlete does go down, you know, what do? Do you go ahead and, you know, do a on the field kind of examination to where you figure out, are they healthy, or are they hurt bad enough to where you don't want to get them back up? Do you want to go ahead and kind of immobilize an injury? You know, say they have a broken leg. You definitely don't want them getting up and standing on that thing because they could further injure themselves. So you want to make sure that you're good at that so that you don't they don't get hurt any further. Examination of an injury. So you have an on-the-field examination injury. If they're good enough to go ahead and get up and get back to the bench, you can do an off-the-field examination to where you can kind of dig into it deeper and find out exactly what's going on. Can they get back on the field? Can they play? Or is it something that's going to kind of require a little bit more to where they need an orthopedic consult or something like that? So you have things called special tests that you're actually going to use, and you're going to figure out exactly what it is. Is it an ACL, a rotator cuff, different things of that nature, to where you can figure out exactly what's going on and get them the proper care that they need. Your clinical diagnosis, this is you're treating the signs and the symptoms of things. You're not necessarily, in the clinic, you're not going to have an MRI machine. So you're going to have a clinical diagnosis, or a clinical diagnosis. You're going to figure out with these special tests exactly what it is. Like I said, you're going to find out whether it's a labrum, whether it's a rotator cuff injury, you know, exactly what it is and what needs to be done so that the athlete can get back to playing, which is their ultimate goal. Treatment and rehabilitation is the next thing. This is what I really like. I like taking an injury, somebody that's hurt, whether it's post-op or whether it's just a little ankle sprain, and go ahead and get them to where they're strengthened back up and get them back on the field. Some injuries can take as little as a week. Other injuries can take up to 6 months if you have an ACL to get them strong enough to where they can play again. The requirements that you have to kind of meet in order to become a licensed athletic trainer is you must graduate from an accredited program. There is some programs out there that aren't accredited, and if you don't go to one of these accredited programs, you're not going to be able to sit for the board certification exam, which ultimately is what you're wanting to do. It's going to have academic, kind of an academic curriculum, which is, you know, you're going to have your care and prevention classes. You're going to have your kinesiology classes, which is just kind of the study of movements, what muscles are working to where, what muscles are working so that you can throw a ball or kick a ball or whatever, so that you know exactly what muscles to pick on when somebody does get hurt. You also have kind of a clinical curriculum. Kind of your first year, you have people that are called uppers. You don't get to do a whole lot. You might get a tape a little bit, but you don't get real hands-on until, you know, maybe your junior, senior year. So those are two different parts of the kind of the training that you will get in order to kind of get out on your own and be able to sit for the BOC. You need to be proficient in all of those. You have to pass your BOC exam. I know that they've come up with a new deal. They're kind of these accredited programs. You have to have a 75% pass rate on the first time, and I think the second time is like an 80% pass rate. And if you don't meet those requirements, the accreditation for the school is on a probationary period, and if you can't get those up, then they go ahead and they take that accreditation away. And I know that some schools have had problems with it, but most of them are keeping up kind of with that trend. And you also have to practice under the direct supervision of a physician, so that you always have someone that you can get a hold of if a problem arises, and you can kind of go back and forth with them so that they get the right care that they need again. These are some of the accredited programs here in Missouri. There's not a whole bunch of them. Central Methodist University is where I went. They've been accredited for quite a few years. Lindenwood University, Southeast Missouri State, Southwest Baptist, University of Central Missouri in Warrensburg, and the University of Missouri in Columbia as well. I know that there's a few of these. In 2020, I think it is, they're going to a master's program, and I know that there's been a couple that have kind of dropped out and aren't going to continue on. I guess they don't want to go to the master's program or something. There's some reason that's stopping them from doing it, but there's going to be a couple of these, I think, that are going to drop out as well. All right, so your curriculum, that's going to directly focus on athletic training, because of course you're going to have your gen ed courses that you're going to have to take too. You're going to have your English, you're going to have math courses, you're going to have your science courses such as biology, your human physiology, all that stuff. Human physiology, human anatomy and physiology is very important because you have to know the underlying structures that you're working on. So that was a class that I really enjoyed taking, just because it's important. It gets kind of dangerous if you don't know what you're actually working on or how something works. Then you need, I mean, you probably ought to go and review, I guess, but you definitely want to know exactly what you're working on. Injury and illness prevention. This is just, again, kind of preventing these injuries from occurring. And if you have one of these injuries, it goes directly into first aid and emergency care. You need to know about the illness in order to be able to treat it, whether it's something as simple as a heat stroke or some sort of cold-related illness or something like that. You need to know how to take care of that, because if it's not taken care of properly or quickly, it can potentially, it could be pretty life-threatening. Also, emergency care and first aid. If someone gets cut, you want to be able to take care of that, whether it's, if it's just a little abrasion, you can go ahead and you can put a Band-Aid on it. Or if it's something, I had a kid that come down on a basketball team, ended up busting his chin open and had to kind of strip it shut to where it would quit bleeding, got him back out on the court. You also want to be able to take care of people, which it's scary, but with, a spinal injury, you have to be able to, immobilize them to where they can't move, further hurt themselves. You definitely don't want that. And you also have to know who you need to call. If you need to go ahead and make that call and get an ambulance here to where they can, get them to the hospital, or they can do what they're trained to do. You also want to be able to assess injuries. Like I said, again, special tests, they're important. You want to know exactly what it is that you're treating. You want to know who you need to get them into, whether it's a doctor, say they end up, tearing the rotator cuff. You want to get them into an ortho, whether it's an abrasion or something like that that's maybe infected. You want to be able to get them to a family doc. Whoever you need to get them to, you want to be able to, go to those doctors and get them taken care of. Next, too, you also learn about therapeutic modalities. Therapeutic modalities are kind of things that are going to help speed that healing process along, whether it's getting inflammation out with electrical stimulation, whether it's getting a quad going again after an ACL with neuromuscular electrical stimulation. We also have a thing called iontophoresis, which is it's a thing that's going to it injects a cortisone steroid that's going to get in there, and it's going to help decrease inflammation. There's all sorts of different things that you can do to help somebody out and help them get better quicker. Next, you kind of want to know a little bit about nutrition. Some of these kids, they come in and they're wondering why they're not performing very well with their athletics, why they're kind of falling off. Some of it goes directly to their nutrition. They're wondering why they cramp up. Well, you can't go and you can't drink a big bottle of Mountain Dew and eat a Snickers bar and go out onto the field and go play. That just doesn't work. You need to take care of your body so that you perform to the best of your abilities. Kind of some work settings. You can do like Andre, work at a high school. You can work at a collegiate setting, whether it's a community college. I fill in and work over at State Fair, work some of their home games. They've recently hired a full-time athletic trainer who's kind of stepped in and took my spot. You could also work for professional sports, whether it's hockey, football, soccer, whatever it is. All of them pretty much have athletic trainers. You can work at a physician office as a physician's extender. You can work in a commercial setting, kind of like a factory. I know some of the factories here in towns have athletic trainers. Say somebody gets hurt, there's the factory. They come in, they come see you. You can kind of talk with a case manager or their supervisor or whoever need be to get them to where they need to go, or you can ice it and, tell them to go back to work. If there's a lot of injuries occurring on a specific machine, you can kind of go and you can check out the ergonomics and make sure that they're not putting their body in kind of a compromised state to do what they need to do, and you can show them a better way to use their body more proficiently. Also, some of the youth sports facilities have it. I know Show Me State games, they have one that, say a kid gets hurt, you can take them up. I think it's up by the concession stand. You can take them up there, get them checked out to where you can know if it's safe for them to go back to play or not. All right, so maintaining your certification. There's things that you must do in order to keep your certification current. If not, it kind of goes to the wayside and your certificate's gone. You must complete continuing education units. You have to have 50 continuing education units per period, which is every 2 years, and you have to have 10 evidence-based practice courses, also 10 hours of it, which is just kind of, it has research behind it. It's not just a course to where, you know, you're taking one just to take one. It has actual evidence behind it. You also have to meet kind of your first aid CPR stuff. Those continuing education units, it just kind of helps you stay on the cutting edge of technology and medicine. For professional development as well, if there's things that you're not good at, you can take courses to kind of pinpoint those and further yourself, put more tools in your arsenal to where you can help them get better. You also can master new skills. If there's something you've never done, you can take a course, and like I said, it just adds ways for people to get better. Furthering professional development and, like I said, exploring new knowledge as well. All right, so I'm going to hand this over to Andre. This is just a day in the life of Andre. He's going to kind of go through and talk to you about a day of work.
All right. Like you said, I'm Andre Taylor, Smith Cotton athletic trainer. I had the privilege of working in a clinic a lot this summer, which was different for me. I am a certified athletic trainer, licensed in Missouri. So licensed in Missouri, I mean, in every state you have to get a different license. I don't know if Corey covered that, but every state you have to get a different license. You have to get re-licensed in every state. I have my master's in exercise science. I'm also a corrective exercise specialist, which is one of the continuing educations that Corey was talking about earlier. I got my bachelor's at Missouri Valley in exercise science and athletic training. Then got my master's and worked as a graduate assistant at Arkansas State, and got my master's in exercise science, where I worked with the football team and a JROTC team. So those are different. So in my experience, I did a clinical rotation just about everywhere. And at that point in my life, I was telling myself, I don't want to be a athletic trainer, and I don't want to work high school. And I've done both. So I came to the conclusion that I'm not going to tell myself I'm not going to do anything anymore, or else I'm going to do it. So in my experience, I've worked with different levels of athletics, D1 to JUCO at Fort Scott Community College to now high school. So I've had experience at every place. JUCO being the hardest ever. If anybody goes to JUCO, anybody knows anything about JUCO, JUCO's a pretty hard life. As an athletic trainer, as a student, as a teacher, it's you get some pretty rough kids. So in my experience as an athletic trainer, I'm also, not only am I just an athletic trainer, I am a psychologist, a mom, a mother, a friend. So people come talk to me about different things and give me different information. So usually in a day in life as Andre Taylor, I'll usually come in to work or come in and do rehab and treatment, usually pre-practice stuff like an hour, 30 minutes to an hour before practice starts. That consists of taping, doing different rehabs and treatments, getting prepared for practice. And then we go to practice and we kind of just hang around, and we hope nothing happens, but at the same time, we want to do something because we're kind of bored. So it's not like we want you to get hurt, but we actually like to do things sometimes. And so things happen, and inside, I might be a little excited, but outside, I'm really not that excited because I don't want anybody to be hurt. But I also want you to get better. So post-practice stuff, or people that's sitting out, I do a lot of rehab and treatment for athletes to get them back on the field or wherever they're playing, whatever sport is. I try my hardest to get everybody back on the field as fast as possible. I am not one of the guys who holds people out for no reason. I try not to, at least. So a lot of athletes don't understand the difference between injured and hurt. So a lot of hurt people come in the training room and thinking they're hurt, but sometimes I just give them a pat on the back and tell them they'll be all right. That's a part of being a psychologist as an athletic trainer. So that really consists of a day in life as Andre Taylor. There's a lot of work that you don't see happening that goes in athletic training, especially at the D1 level. I keep trying to tell people all the time, because they've talked about athletic training, that D1 life is actually a little bit easier than you think it is. Just the fact that They have doctors, physical therapists, chiropractors, massage therapists. They got just about everything. So you got access, a lot of access to things right at the school. Instead of having to go all the way to the doctor's office, they come to the school and they do the treatment right there. So I think my hardest job was being at JUCO. I was one athletic trainer with 4 students in a lot of sports, and everybody demands your attention. Everybody wants your attention, so it gets pretty difficult, but I think I love my job. Smith Cotton has been pretty good to me. That's good. Thanks, Mr. Rob Davis. But, I mean, that's about it. You want to take the rest?
Oh, hold on. All right, so kind of a little bit of additional services too. Dr. Stout started something the other day. He started an injury clinic, which is on Saturday mornings. It starts on the 18th, correct? Yeah, at 8 o'clock in the morning. We appreciate it if you kind of show up at 8 o'clock. It's from 8 to 10, but being there, early at 8 o'clock is nice so that we kind of know exactly what we're working with and how many people we need to get in the door and get out. Speed and agility also, we do that over at the clinic. We do it for, single athletes. We do it for teams, whatever. We're pretty flexible. If there's things that you want to work on, we do that over at the clinic. We also we can do kind of like a little bit of a private consult and get you where you need to go. If you come into the clinic, you can always, our clinic's open from 6 o'clock in the morning till 6 o'clock in the evening. So a phone call kind of to let us know so that you can fit into a schedule, because we do see a lot of patients there as well. The phone call would be nice so that we know you're going to pop in and we can get you seen and kind of, whether, like I said, it's an infection or something, we can get you in maybe with your family doctor, tell you that, or if it's ACL, we can get you in with one of the doctors, just kind of to facilitate that and help that on its way. Also, I also have my PTA he wanted me to touch on a little bit. I went and got that so that I could work more in an outpatient clinic. It's more predictable hours. Also, as well, I'm able to work with a more broad perspective of clients, from little kids to older people as well. It opens the doors up for more opportunity for me. It required a peds class for me, neuro. I mean, there was a whole curriculum for that too, but it covered a broader range. Anyways, do we have any questions?
Thanks, Andre, Corey. They were on time. I didn't get to blow my whistle. But many athletes think that they'll make a living in their sport. Probably not many will. But a way to be involved in sport is athletic training, certainly. The University of Virginia, every high school of every size had their own athletic trainer. I think in the Midwest, we're catching up. And at any level of sport, we look at care, we look at prevention. There's always going to be risk. There's always going to be injuries. We hope they're minor, but they're inevitable. And we know about the long-term sequelae of injuries, focused on head injury, concussions. They've looked at that extensively. Many people might not realize that women's soccer is the highest incident of head injuries of all contact sports. But looking at that in the long term, Dr. Kelly Edwards is going to talk about his personal and professional experience, 30 years in orthopedics from Loma Linda to UMKC, and then 30 years in orthopedics on the sequelae of injuries.
All righty. We haven't choreographed this before, so if things go a little slow, just bear with us. I'm Dr. Kelly Edwards. I've been orthopedic surgeon here in town for, I think, 31 years now, going on the 31st year, I think, Doug. And I was asked to talk about long-term sequelae of sports injuries. And I would kind of actually term that sports trauma, because you're going to have some athletes who receive trauma and may well deny that they've been injured. And a classic example of that is a concussion or a sprain that's sore and hurts, and the patient, they may limp off the field, they may have a little bit of fuzziness, But typically, when someone takes a hit to the head, they'll deny that they've got a problem. They will say they're fine universally. And that does not mean that there hasn't been an injury to the brain in terms of a concussive event. You're also going to have repetitive or cumulative injuries, like repetitive ankle sprains, repetitive knee injuries where there's been a series of surgical treatment for the patient. And these changes that occur within the joint are cumulative, they add up. And then there's going to be your acute, severe, career-ending, function-changing, or life-altering injuries. And you'll see those. We've got a few to show you today. How many athletes do we have here today? All right, so if we show these videos, there's Doug, our tree climber. If we show these videos, these aren't to scare somebody about the potential injuries, but anyone who plays a sport, contact sport a bit more so, but even non-contact sports, there's plenty of injuries that can occur. And if you're engaged in these kind of activities, injury is certainly a possibility. Let's start off with the concussions. All right, there's a whole lot of attention on concussions now in the NFL. As you all probably have heard, there has been a move by ex-players, retired players. About 4,000 players have sued the NFL for benefits relating to chronic brain trauma. Recently released injury data showed that just from 2016 to 2017, 2016 there were 243 reported concussions in the NFL, 281 the next year. Whether there were more head hits, more actual injuries with the increased attention towards the way we're tackling and the way they're calling these hits these days, or whether it's just an increase in recognition of the injuries is hard to say, but that's a 16% increase in 1 year. Along with the concussions comes later on in life increased risk of depression, dementia, and ultimately what's called CTE. It's now termed CTE, and that's really a post-mortem diagnosis where you've heard some of the players want to donate their brain to science. So CTE stands for chronic traumatic encephalopathy. And that essentially means that there's been injury to tissue atrophy of the brain that occurs with these repetitive traumatic concussions. The real-world effects in the NFL, there's a release rate based upon who stays on a team, who gets released. And the average career length in NFL right now is 3.3 years. That's the average length. At one point in time, it was about 2.2 years for an NFL running back. What they've shown is that there is at 5 years after a concussion, one major concussion, there is an 11% versus 36% remaining in the NFL. Meaning if you've had a concussion, you have about 1/3 the chance of being in the NFL at 5 years versus a non-concussed player. There's a increased incidence in the after effects in terms of just everyday life. And you've heard about some of these really heartbreaking stories like Junior Seau. These guys are so affected by the dementia aspect and the depression aspect that some of them even take their lives. And so the increased attention to how you tackle is extremely important. You know, in most talks you go to, if you go listen to a talk, I remember hearing this one time, if you can leave a talk and carry away 2, maybe 3 salient points from the talk, then you've done well. If I throw a whole bunch of statistics and information, people may walk out of here like, okay, so what? So the way that in which the players are taught to tackle is going to change. It's going to change. I was never taught to tackle with the top of my head, the crown of my head, or with my face. One of my buddies who played defensive back for Kansas State, he was always taught to come up and tackle with his face and his helmet and hit with that first. I was taught to tackle a little bit more like a rodeo. You can make a hit, but you're supposed to wrap them up and take them down. You're supposed to get them on the floor. And so the type of tackling with a shoulder hit and a wrap versus that frontal head hit is really, really important. And it isn't just the traumatic brain injuries, but the neck injuries. And we've seen a few catastrophic neck injuries. Darryl Stingley would be the most dramatic example I can think of. There's some others. But the cervical spine is not designed to absorb the energy of two grown men at speed making contact. And typically it's the receiver looking back for the ball who's a bit unprotected and the defender hits him. And that's what happened with Darryl Stingley. Darryl Stingley was doing a medium length slant route, and you'll see on the video he's extending with his right arm looking back, and he gets hit head on by Jack Tatum. And it really wasn't a dirty hit, but it was direct head on, shoulder and face of Darryl Stingley, but he right onto Darryl Stingley's crown of his helmet, and the cervical spine just will not tolerate that kind of trauma. It was a career-ending quadriplegic injury for him. I would beg as someone who's been around football for a long time, played the game some, and has many friends who have played, I would beg the coaches to teach the players how to tackle properly. It's just so important, so important. Everybody's looking for that ESPN top 10 play mega hit, and I'm a bad player, but getting the opposing player on the ground is the real objective, and tackling isn't all just about an end-on hit. Repetitive injuries. Use an example. Anybody in the room ever heard of E.J. Holub? Anybody? Okay. E.J. played for the Dallas Texans, which then became the Kansas City Chiefs that Lamar Hunt started. Lamar Hunt basically started up the AFL. E.J. Holub played center and linebacker for them. He was 6'4", 236 pounds. 236 pounds wouldn't get you at center these days anymore. 285 is a light center. He played college football at what was Texas Technical College, which is now Texas Tech University. Highly decorated in college, 5 times first team AFL All-Pro, and then 5 times second team. He was inducted into the Chiefs Hall of Fame and put up on the wall. I saw him at a event when he was 48 years of age. 48 years of age, and he had to walk out to the 50-yard line with Lofstrand crutches on, like someone with severe polio or a spinal cord injury. And this was from repetitive knee injuries. Now, the statistics that I heard on him was 17 knee surgeries. I thought what I read was during his playing career, but he only played for the Chiefs for 9 years. I think that was his cumulative number of surgeries, but he was essentially a cripple, even to the point that his ligamentous instability of the joint made it difficult to do a knee replacement that was going to be stable. So here's someone who, in 9 years of professional life, basically gave up his future function as an adult man in terms of what he could do. Lofstrand crutches are those crutches that come up on your forearm, and it looks like someone with polio walking. And I was amazed. Here he was, 48 years of age, and could barely hobble out to the middle of the field to get his recognition. That's an extreme example, but there are many players who an initial injury is the beginning of that whole process of internal derangement problems, pain, arthritis, instability of the joint. And I myself have had 7 knee surgeries over the years and never played that level of competition. We'll see patients that have had knee reconstructions early in their career, and you'll see them years on down the line, and that post-traumatic arthritis is a part of life for football and basketball players. It's just a part of life. He played 127 total professional games, 127 total professional games, and had 17 knee surgeries. That's 1 surgery for every 8 games or something. That's unbelievable. And he's an extreme example, but that's exactly what you will tend to see with some of the long careers in the NFL and the NBA. We're going to have a few little videos to show you. I hope those go smoothly. We haven't run through that before. The acute, life-threatening injuries. Example I would make would be Bo Jackson. In my opinion, Bo Jackson was one of the 3 greatest running backs to ever play the game. Bo Jackson, anybody know Bo's real name? Vincent Edward Jackson. He played at Auburn, played for the Raiders and the Royals at the time. I was an orthopedic resident at St. Luke's Hospital when he was injured. Do you have the video of him? Okay, we're going to watch a little video. He's running around the right side, gets into traffic, and you'll see him decelerate and try to change direction. When he does so, he's got himself totally loaded on his left hip, his left leg. And the angle that he's at, you will see he's forward flexed, his hips back, and if you can see it on the slow-mo,
It's not loading here.
not loading. Anyway, if you watch this, you can go on YouTube and easily pull these up. I did it on my phone last night.
My quarterback. He is my quarterback, and the team just continued to function. And fortunately, in the sense they didn't have to have him playing great football, because a lot of other people were. Bo Jackson has some room. One man to beat, and from behind, Kevin Walker saves another touchdown. This is just what the Bengals wanted to avoid, and just what the Raiders were expecting sooner or later to happen. Some beautiful blocking at the line of scrimmage, and Bo is so strong physically. Those legs are so strong. Talking to Fulcher before the game, he said you can't tackle him in his legs. Look at Steve Smith kick his man out. A great job by Montoya. A beautiful job of pulling and blocking, and watch these broken tackles. So his legs and, of course, the blocking itself. And Walker, as he made the tackle, had only the one leg to grab, and apparently Bo Jackson, shaken up a bit, has not gotten to his feet as yet. That was a 34-yard run by Jackson, who does not appear to be seriously injured and gets a big hand from this crowd. What a player. He may have pulled a muscle as he was trying to pull away from a tackle, because he really wasn't hit on the knee. Now watch Kevin Walker in the final analysis. He's making all kinds of plays. He's pulling on that leg, and it could be that he just pulled a muscle that Bo did trying to pull away.
Whether he was fully dislocated or subluxed is not clear, but he was able to get up off the ground and walk. The initial x-rays on his hip that were taken looked normal. Steve Joyce was the team physician for the Kansas City Royals at the time I was working with, and since he was playing on both teams, the Royals were very worried about what his injury was going to lead to. Within 2 weeks after his injury, his hip appeared to be bone on x-ray. What they say is that he had avascular necrosis, a reduction of the blood supply to the femoral head where the bone actually necroses. In truth, what was felt to have happened was that he subluxed his hip out over the rim of the acetabulum, and when his muscle strength is so good that he corrected it himself, it popped back in. So the femoral head sheared on the posterior rim of his acetabulum and actually sheared the cartilage off the head acutely, is what they feel happened, and probably tore his posterior labrum. His strength is so good that he was able to, he reduced it on his own, limped around, walked off the field, didn't play. He never played another down of football. About a year after the injury, or no, less than a year, he had a total hip replacement by an orthopedic surgeon in Chicago, one of the world's best joint replacement surgeries. He did not play football again. He did return to running the bases. The Royals had released him, and I think he got picked up by the Cubs. And they made him a designated hitter. He would try to run to first base, get to first base, and then they would put in a substitute runner. He was a designated hitter only for one season. 18 months after he had his total hip put in, they had to go in and revise the whole thing, take it out and redo it. The amount of stress as a man with that kind of strength and power is going to put on his hip, just because he could return to playing sports, was what they predicted, was obviously not a good recommendation. The man's career was over. He was an incredible athlete. The only athlete ever to be all-pro in two separate professional sports, both baseball and football. He was a phenom. End of career, done, over. Doesn't matter how tough and how strong you are. Napoleon McCallum, anybody heard of, go ahead?
Henry Josie.
Henry Josie. Henry Josie's a running back at the University of Missouri. His freshman year, freshman or sophomore year, I'm not sure. Anyway, freshman or sophomore year, he's fourth in the nation in rushing after like the first 5 games. The injury that he had, it will show him making a left-handed sweeping move, pitch out running back, and you will see his knee buckle, and this was considered to be a 2-stage injury. They think that he tore his ACL, but still had the momentum and strength, went on around the corner, and then he got hit from the front, and it ruptured his patellar tendon. So here you had a guy with an ACL tear, posterolateral corner injury, ruptured patellar tendon. It took 3 surgeries to get his knee back to the place where he could play. He did actually return to play and played in the CFL. We'll see if we can show that one.
Internet service
It's
here,
all
I
right.
think.
But it required Dr. Stannard and Dr. Smith together operated 2 surgeons, 3 different surgeries to reconstruct that young man's knee and get him back on the field. And he came from a family with very little financial background. This was supposed to be his career, just taken away like that, basically. So there are some injuries that are catastrophic from the outset in terms of the degree of damage to the joint. It's repairable. But the level of competition, when we're talking even Division I college nowadays or pro, the level of competition, all it has to do is slow you down or weaken you a mild percentage points, and your competitiveness is dramatically reduced. It's a very fine line for these players at this level.
All right.
Haven't had that one?
It's loading, I think.
Now, the Napoleon McCallum.
This is
Anyone
still-
heard of
this is still Josie.
We'll
If
get
you
there.
wanna see
Yeah,
that.
go ahead and show
I'm
it.
sorry.
In some way, at some time, we're all fragile. When we break, the hard question is, are we wreckage or are we salvaged? Ruined or remade?
This was a car wreck. This type of injury in your knee doesn't happen playing football.
There was so much doubt. I would cry about how much doubt I had in me. I didn't ever think I would be normal again. Like, I thought I was somebody else because of the injury that I went through.
In 2011, Henry Josie was leading the Big 12 and was 5th in the country in rushing before one late season run.
So the worst video that you'll ever see of a knee injury is Napoleon McCallum. He played for Navy, played for the Raiders,
Jefferson City native.
and he is from Jeff City. That's correct. He grew up in Jeff City, Missouri. He dislocated his left knee in a game against the San Francisco 49ers in January of 2010, getting down near the end zone to score, and you'll see that his left foot is planted into the turf where it can't move. He's getting hit at the tibial level while he's going forward, and he hyperextends his knee. This is a posterior knee dislocation, which results in virtually complete ligament injury to anterior posterior cruciate, posterolateral capsule, and it dislocates enough that it will stretch nerves and artery, and he actually tore an artery and had to have immediate surgery that night to save his leg. End of career. One play, end of career.
Callum, number 41. And there's a San Francisco 49er on his back underneath.
I think it's Ken Norton. Just looking at the rest of the defensive unit, not seeing, there he is, yeah. Ken Norton.
And what is Jeff Hostetler doing? Let's watch the conclusion. There's McCallum, 41. That's Ken Norton, number 51 there on the left.
Fell on.
Oh, my Lord.
Lord, you don't want to look at it.
Oh, there is Napoleon. Oh, my Lord. Napoleon McCallum's knee is, oh, Lord. Don't look at this if you don't want to see it. That is as disastrous of an angle as I have ever seen a player's knee and leg come out.
Anyway, so my experience has been that my knee injury started after a clipping maneuver. Got clipped from behind, cheap shotted after I'd stolen a basketball making a layup, and it was one of those on a basketball court where I got clipped from behind. My knee was caught behind, clipped from behind, leg gets trapped, you get bent back over, and you're loading that lateral meniscus under flexion, and you get a tear. And that starts that downhill process. Now, my opposite knee's had surgery 3 times without an acute injury, so probably my arthritis is more genetically related, accentuated by the trauma, but probably more genetically related than just a prime injury that you can point at, just years of playing ball. After my first knee surgery, Steve Joyce told me not to ever go back on that basketball court, and 15 years later I listened to him, and you end up with post-traumatic arthritis. It's a result of your activity level. The difference is, you take most athletes and ask them, if you asked me, what would I do if you gave me back my body at 22 years of age from here down? I'd head right back out onto the court, right? That's what's going to happen. And so the salient points I would have is the technique of tackling to avoid the head injury is just so important. We just don't need those kind of injuries to the young brain. And secondly, when the players are playing, if you're a smaller player, you've got to drive through that tackle, drive through that hit like a knife through hot butter. If you hesitate at the moment of impact, you absorb the energy. And so it's the effort that the athlete gives. The trainers can do an awful lot in terms of preseason conditioning, having players in good shape, but that doesn't rule out the risk of injury. And ankle injuries, knee injuries, they're just notorious in the contact running sports, soccer, football, basketball. The repetitive injuries lead to post-traumatic arthritis, and you're going to see so many of your older athletes having had multiple surgeries later on in life as a result of that. That's not going to stop anybody from participating. One of the issues that comes up, you hear about in the young sports with the young football players. One of the things that Doug put on the note to me was many families won't let their kids play football. I can tell you, I love football. I grew up in Lincoln, Nebraska. I was born with red underwear, right? I would be reluctant to encourage any of my grandchildren to play contact football. I would want them to learn flag football. When they get to high school, they're going to play tackle football, but the head injuries, the contact, that kind of activity going on in the 3rd and 4th grade, I personally have issues with that, and I'm going to tell you that there would be some coaches that would argue with me on that. But you're going to probably see less of the tackle football going on in the younger ages, and they're going to play flag football. They can still learn the sport, learn the moves. Barry Sanders, the best running back of all time, will tell you he learned all his moves playing flag football. All right? Anyway. The last one here is Darryl Stingley's injury. The videos are really bad, but this is another player from, was it Rutgers? Rutgers.
Late in the 4th quarter to tie games. So we have a new football game with 5:16 left. Santee to kick off, and this is a good one. Inside the 5. It's Malcolm Brown. Oh, what a great open field hit by Eric LeGrand, who is shaken up on the play. Boy, when you play on those kickoff teams, Kurt, you have sometimes you got 40, 50 yards of momentum running at full speed, and then you initiate the contact by just throwing your body in midair. And sometimes the end result is unfortunate.
Let's see it. That was a violent collision.
Eric LeGrand, 6'2", 275-pound junior from Avenel, New Jersey. They have a stretcher out there. They have a cart out there. Greg Schiano is out there. And players on both teams have taken a knee on each sideline. And their thoughts are with LeGrand. Kurt, how many years you play football, counting your high school years?
Oh, say 15 or so, 16 was all said and done.
Can you describe what it's like when something like this happens to one of your teammates?
Well, it brings back the reality of the game itself, and that it is a collision sport and a violent sport. And, you know, this is a tough situation for not only the opposing team, but the home team, and especially when you see a guy that you have played with in this particular situation, and you're friends with him, and you see him in this type of situation. It's a sick feeling in your stomach.
We're going to step aside with 5 minutes and 10 seconds left. Stadium. We're back at the Meadowlands Stadium, where play has come to an abrupt halt because of an injury suffered by Eric LeGrand on the Rutgers kickoff. LeGrand came flying down the field, made the tackle, and went down suddenly. And the one thing that is comforting to know is that he has already received and will continue to receive the best and quickest medical attention. So our thoughts and prayers, needless to say, are with Eric and his family. It's always disconcerting, Kurt, when you see something like that happen, when you judge what the immediate observations are from the others around him. And you saw Greg Schiano come flying across the field. In fact, Greg is on the far sideline, and I'm wondering whether he's talking to a family member. Yep.
Yeah, it does look like he's talking to a family members over there.
Perhaps Eric's mom is wearing number 52.
Yeah.
So we wish him the best. And watching a football, you see a lot of these sort of situations. They almost always turn out okay.
And that's what we're hoping for, that this turns out okay. It's a precautionary type thing, and hopefully we can get an update here sometime later.
Doesn't look that much more impressive than any other tackle. The angle of the head, the way the head is turned when the contact is made, the crown of the helmet, the cervical spine is really not meant to tolerate that. And so there are things we do to our physical structure in sports that they weren't really designed to withstand.
I guess we don't have very good internet here.
And the last thing I would say is beware of old guys who tell you how fast they used to be, okay? All right. Do you have any questions? Anybody have any questions? All right. I will hobble off the stage.
Thanks, Kelly. My brother and I were both into sports. My brother was a 3-time all-conference basketball and football player. I barely made a letter. He's getting ready to have his knee replacement. I still hike and ski and bike race and do a few things. And our genetics, as far as we know, are pretty close to the same. Every organization has behind-the-scenes work. Athletic directors have a lot of it in the sports world. Hiring coaches and staff, finances, legal issues, liability, schedules, conference alignment, facility development, equipment, drug testing, eligibility, or parts of the sports program we don't think a lot about. And so Rob Davis is going to give us a little bit of an idea on education and athletics. Rob is the athletic director for Smith Cotton High School.
I knew not to put any videos on here because the fair's in town, and whenever the fair's in town, everybody's on the Wi-Fi, so I think that's the issue. Again, I'm Rob Davis. I'm the activities director here at Smith Cotton High School, and Dr. Kibbers gave me several things as potential topics to discuss, but what I really wanted to talk about today is the Why We Play initiative and education-based athletics. Clicker. Perfect. This is my 16th year as the activities director at Smith Cotton High School and my 20th year as an athletic director overall. I've been in education now for 24 years, and all 24 years I've either been a coach or an athletic director. Along the way I also did a little bit of teaching. I've coached at the collegiate level, the high school level, the junior high level. I've done a little bit of everything, some of it better than others. I was not a good volleyball coach, I can tell you that. And the difference between baseball and softball, you wouldn't think isn't that big, but it's huge. I like to think of myself as a pretty good baseball coach, but I was not a very good softball coach. So I've done a little bit of everything. I've coached a high school girls basketball team that finished the season with 5 girls, and we got 1 win on the year. Anybody heard of Sturgeon High School, north of Columbia? That was back in the late 90s. We finished the year with 5 girls. The first week I was there, I had a 6-foot center get caught smoking. We were going to set her out for a while. She didn't like that, so she quit. My best point guard, she quit because she didn't like some of the rules we were throwing down. So we ended with 5 girls, won 1 game. And I can tell you the only reason I survived that year is because I had a really good athletic director, which happened to be me. I happened to be the athletic director. So I got to go into the board meetings and talk a little bit about the coach and support myself. Otherwise, I probably would have been canned. That was the best coaching job I ever did because of the situation. It was new. I wanted to implement some stability, some discipline, which it had been lacking. And so I'd like to think, even though we got 1 win, I did a pretty good job as a coach. I was part of the '94 national championship team at UCM. That was the easiest coaching job I ever had. You recruit good players, and you throw them out there, and in my case, I just stayed out of the way. I helped a little bit with recruiting and pitchers and catchers, but that was easy compared to that year in Sturgeon, finishing with 5 girls, trying to keep their attitudes good, trying to keep them positive, and trying to keep them motivated. So education-based athletics, what is it? All high school and junior high sports should be education-based. They're an extension of the regular classroom. Athletics provide an opportunity for learning skills not typically learned in the classroom, things like accountability, sportsmanship, teamwork, hard work, being part of a team, accepting a role. All those are things that don't necessarily come across in the classroom, but those are things that we're really trying to teach on the tracks, courts, fields, pools, and courses. Athletics should complement what we do in the classroom. We should be teaching our basketball players and our football players just about the same way our teachers are teaching in the math classroom. Athletics are inherently educational and should be used as a teaching tool. Therefore, our coaches are teachers of life skills. Unfortunately, sometimes there's a disconnect between the public's perception of what an athletic program should look like based on what they see at the collegiate or professional levels. At those levels, winning is a bigger focus. The higher up you go, the more it becomes so. Coaches and programs are often judged solely on tangible outcomes. How many games did you win? Is my child playing? Those are things that we look at. Oftentimes, unfortunately, our spectators think if you buy a ticket, it gives you the right to say what you want, do what you want at a game, the way you talk to officials and the way you talk to coaches. We can do it that way, but then you end up with this. And this isn't what education-based athletics is about. You think this young man down here on the left has seen that before from his parents? That's learned behavior. And he's 4 or 5 years old, I'm guessing, and that's the way he feels it's okay to act at a game. So, all that being said, you might be asking, well, Davis doesn't think winning is important. That's not true. Winning is extremely important. It's our goal, but it's not our purpose. Our purpose for why we get up every day is about education, educating our kids. Our goal is to try to prepare them to be winners. Winning is our goal. It's very important. We plan, practice, and play every single day to win. Our coaches and kids put in a tremendous amount of time and sacrifice on trying to win every game. One of the skills we want our kids to develop is the ability to be competitive. That's going to help them later in life. So that is an important skill. Winning helps keep you motivated. Winning is fun. We want sports to be fun. So winning is important. However, since 2000, which is 18 years now, Smith Cotton has only won 9 team district championships. I might be looking for a new job after this. In that time, we've had one team reach the Final Four. That was our boys soccer team back in 2014. Every year, good coaches are driven out of the profession either on their own or under duress due to the pressure or unrealistic expectation to win. Sometimes you just don't have the horses to win. So what's it about then? It should be about the development of your children. So I need non-Smith Cotton coaches. Take a guess if you know. When was the last Smith Cotton team state championship? Anybody have an idea? 1993. Anybody want to guess the sport? Girls golf. They had a really good run there in the early 90s. But if we're measuring our success on state championships and district championships, then we're failing miserably because we're just not doing it often enough to justify the reason that we're out there doing this stuff. So if it's not about winning championships, is it about sending kids to play in college? A lot of folks think that it is. You know, my kid needs an athletic scholarship. I need to send them to college. The only way they can get there is through athletic scholarships. If an athlete wants to play at the next level, our coaches will do everything they can to help them. They put in 4, sometimes 6 years with our programs. We owe it to them to do everything we can to help them find a place to play. Our coaches spend years building relationships with college coaches in order to build relationships so that they can send kids to the next level. When we have successful teams, when we win, it does help us. We're able to send kids places. We average about 5 to 10 student athletes receiving athletic scholarships per year. However, the last 2 years, we've had over 30. So we've had a really good run. We've had some good kids. They've been talented, and we've been able to help develop that talent. We're sending kids to area schools like State Fair, Missouri Valley, Central Methodist, but we're also branching out. We're sending more and more kids to outer state universities and colleges and out of state university and colleges. But athletic scholarships should not be an expectation of our participants and our parents. I see families spending thousands of dollars every year on individual lessons, competitive leagues, and the best equipment money can buy. They have better equipment than what some of our college kids are using. But they feel if they buy that for them, they're going to perform better. And you're not going to see a financial return on that investment. I would recommend using that money, put it in the bank, and use it and save it for paying your way through college. Unless you've got the money to do so, then by all means do it. Because in reality, only 3% of high school athletics or athletes nationwide are actually going to get an athletic scholarship. So the chances of it happening for you are low. Excluding NCAA football and basketball, the average value of a one-year athletic scholarship is about $8,500. The average cost of tuition for an in-state public institution is about $35,000. Again, how far would that money go that we're spending on clinics and lessons and things like that? There's over $10 billion available in academic aid each year and less than $1 billion in athletic aid. So the best way to get a scholarship isn't on the field or on the court, it's in the classroom. If a kid comes up to me and says, Mr. Davis, I want you to help me get a scholarship, I'm going to say, okay, let's go to the library. Let's get your ACT raised and your GPA raised. If we exist to only provide opportunities for our student athletes to obtain scholarships, again, we're failing. Only 3% are going to get it. So if it's not about winning, and it's not about winning or obtaining scholarships, why are we doing this? We play to provide opportunities for young people to learn the skills necessary to become productive, caring citizens in our community. That's a mouthful, but doesn't it sound a whole lot better than we're out here to win? We play to teach respect. After a kid has played for us for 4 years, hopefully they learn how to respect their teammates, they learn how to respect their opponents, they respect officials and their decisions, they respect their coaches, and they've learned a respect for the game itself, which maybe will carry over into the rest of their lives. And they're going to play soccer recreationally or play basketball recreationally for the rest of their life. We play to teach the virtues of hard work, teamwork, and accountability. Where else can they learn the values of sacrifice, passion, and commitment better than what they learn it on our fields and on our courts and on our courses? It's the best place. They're going to get things there that they can't get in the classroom and things that they don't get at home. We play to serve as an extension of the classroom, and our coaches provide educational support. A lot of times, a lot of our kids, the only reason they're coming to class and they're doing their homework is so that they can stay eligible, because there is an academic requirement in order for them to be able to play. And a lot of times that's it. That's why they come to school every day. Our coaches do grade checks to keep track of what they're doing in the classroom. Nobody else may be doing that. A lot of our parents are great and will do that, but sometimes the coach is the only one that they've got making sure that they're taking care of business. Our coaches provide study tables, after school help. They'll provide them with tutors. One of the things that we do is all of our coaches are required to join coaches associations for a lot of reasons, but one of the reasons they do that is so that they can help provide academic awards for our students, because a lot of those come through the association only. So our coaches are making sure that our kids are taking care of business in the classroom. Another reason we play is we play to learn about helping others. Every single one of our athletic programs at Smith Cotton is involved in service learning projects. They work the Community Cafe, Community Santa Project. You can read through them there, but every single program, that's probably one of the things I'm most proud of, more than the wins, more than even the academic accomplishments. But our kids are learning from our coaches to get out into the community and to give back, and that's huge. Think outside yourself. One of the things that I think has been lost in high school athletics is the fun factor. That should be a big part of why kids play. And if we make it all about winning and all about playing time and all about going to college, and that's your focus, sometimes we forget to just go out there and have fun. So that's a big aspect. That's one of our purposes. That's one of the reasons why we play. So each year, one of the ways that we reemphasize this to our coaches, and our coaches are going to be doing this Monday, is we write purpose statements. I have them pick 4 or 5 virtues or characteristics that they think is extremely important to them. Those things, like I said earlier, accountability, responsibility, citizenship, teamwork. And then they put those into their own individual purpose statement. And they write it down, and then I print them out, and I put them up on my wall. And whenever I have someone from the community come in and want to talk about if we are getting it done on the field or not, I stop them and say, well, hold on. Look at these things that we're doing. Our team may not be winning every game, but we're learning to win off the court and off the field. These things are more important. And I guess if we get nothing out of today for me, I hope you understand how important these things are to me. So some of the purpose statements that our coaches have put together are here. One coach said, I coach to develop leaders who are passionate about achieving their goals, who persevere in times of adversity, and develop positive relationships with all they meet along the way. That's pretty powerful. Again, more important than winning a conference championship. If our coaches can succeed in instilling that in the majority of our players, then we've had a successful year. The other one, I strive in coaching to develop student athletes who are driven, productive citizens, who show respect and concern for others, and are an inspiration for all the lives that they touch. If you're a parent, wouldn't you want someone like that coaching your child? Hopefully so. Hopefully, again, it's not about winning. Another, I coach to build relationships between teammates who may not have those relationships with anyone else. A lot of times, again, our kids go home to an empty house, and the only family they have is their teammates. And so this coach thought it was important to build those relationships within his team to help form a family for some of those kids. I encourage enthusiasm in my team and model leadership through spirit and positivity. I want my team to learn commitment to each other so that they may grow to be committed adults. Powerful. Even Mr. Davis is accountable. I have a purpose statement I write every year. The first few years, I tweaked it a little bit, but I found one that I like, and so this is one I've been sticking with the last couple of years. I strive to develop coaches and athletes with integrity who act responsibly and remain loyal and accountable to their family, team, school, and community. If I can succeed in that for most of the kids that are in my charge and most of the coaches that are in my charge, then regardless of how many conference championships we win, district championships we win, state championships we win, I can say I've had a pretty good year. And like Tony Dungy said in that earlier slide, that's my purpose. That's why I get up every day. I come in and try to provide the support for our coaches so that they can support their kids in accomplishing those goals. So I implore everybody, I mean, this is good for everybody in athletics, out of athletics, if you work at the hospital, what's your why? Know your why. Why do you get up every day? What's important to you? You don't have to write it down, but if you're just floating along and you don't know why you're doing it every day, I can tell you I have a lot of bad days, and if I didn't know exactly why I do it, I probably would have gotten out by now. So it's important for me, especially, to know my why. And I just showed you why it is. I'm trying to build integrity. I'm trying to build teams. I'm trying to build accountability. So what's important is for all of us to know our why and why we do what we do, but I think it's important for kids to know their why. Why are you playing a sport? Why are you coming out every day, putting in the 2 to 4 hours every day after school? Some of you may or may not get to play. Is it worth it to you? What's your why? Why are you trying to get out of it? Parents, same thing. What do you want your kids to get out of participating in Smith Cotton athletics? Do you want them to win? Is it all about playing time? Is it all about scholarships? Or is it about some of this other stuff? Are you hoping they learn accountability? Learning how to accept a smaller role on a team. Learning how to accept a big role on a team. To be a leader. Those are the things we're trying to instill. So I ask everybody to know your why. If our coaches and our kids and our parents share a similar why we do this, why we're participating, then we've got some harmony. And we can avoid this. Can everybody see that okay? This happens. Trust me, it happens more than what you think it does. And that's because our whys are all over the place. Our coaches are going this way, our kids might be going this way, and mom and dad are going this way. Why not let's all go in the same direction and focus on the real reason why we're doing what we do. I'm extremely proud of our victories on the field and the championships that we've won. We have won some championships. It's not all doom and gloom in the results category. But the thing I'm most proud of is the commitment level of our coaches, the amount of time and effort that they put in. Trust me, it's not about the money. Coaches sometimes do this. I added it up. I made 32 cents an hour this year. That's what they do. It's not about the money. It's because they love their sport. And it's because they love their kids. That's why they do it. So that's what I'm most proud of. My job is to provide them with the tools necessary to carry out their purpose. Anybody have any questions for me? I didn't touch on scheduling, finances, any of that stuff, because this is what I do. All that stuff is what I have to do to make this stuff happen. Questions for me? All right. Thank you very much.
That's great. Thank you. Thank you, sir. And we appreciate people being here. This is the start of the crowd. This whole conference will be on YouTube. It'll also be on CD sent out to pretty much every school within 30 miles. There was a note on the flyer that said those that pre-register are signed up for a $100 gift card. Is there a Sabre Moon here? $100 gift card. Unlike coaches, athletic directors don't have TV shows and radio shows and shoe contracts, but if you're a parent, I think you can be proud. Rob Davis is in charge of the activities. We're going to take a 15-minute break. Thank you.